Min.Chris Kresser. Welcome to Women's Wellness Radio.
Thank you, Bridget. I'm happy to be with you.
Yeah, thanks for coming on. So we always start a little bit with the story. So I'd especially like to hear your story. I mean, before you were a practitioner in this world, it sounds like you were a layperson who got really sick. And I wondered if you could share your experience looking for answers like conventional medicine and outside of that and what you found worked and didn't in both systems.
Mm-hmm. Yeah, so I was pretty healthy growing up, competitive athlete, and was interested in diet, but mostly from the perspective of how to improve performance. And then in my 20s, I decided to sell everything I owned and take off for a 2-year trip around the world. And when I was in Indonesia doing some surfing, I got very sick with a tropical illness. And the first 3 to 4 days I was delirious and vomiting, diarrhea, didn't really know what was going on, and don't really remember much of that period other than an Australian guy who happened to be in the village that I was staying in had some antibiotics in his medical kit, and those helped to bring me back from the acute crisis. And I continued to travel for maybe another 8 or 9 months after that. But it became increasingly clear that although the acute crisis had passed, it was evolving into a chronic, difficult condition. And so after about a year of traveling, I cut my trip short and came back to the States to try to figure out what was going on. And saw conventional doctors at first, and they figured it must have been some parasite that hadn't, been adequately treated. And they gave me a bunch of antibiotics, which I took, and I would sometimes feel a little bit better, but then I would quickly feel worse again. And very long story short, it took me about 10 years to finally find my way back to health. And through that process, I learned a lot about what conventional medicine does well and what it doesn't do well. And the short version, I guess, is that conventional medicine is very good at addressing acute emergency and trauma type of problems. Like if we get hit by a bus, we probably want to be taken to the hospital, or, if I have to get a colonoscopy, Western medicine is very good at dealing with those kinds of things. But it's really not at all set up to deal with complex chronic illness. And that, in fact, is the biggest challenge that we face, both as a country and in the world at this point. So, I over that period of time, I learned a lot in my own exploration, and was able to regain my health. And then I decided to go back to school and become a practitioner myself and help others who were dealing with the same challenge, because I saw that there wasn't a lot of support available for people who were going through what I was going through. And I did that, and I opened a functional medicine practice in 2010. And spent the first few years just, treating patients one-on-one. And then I wrote my first book which really kind of covered the diet and lifestyle and behavior changes that were successful for me, based on the paleo approach, but not strictly paleo. But over time, I came to realize that while reclaiming our individual health is crucial and very important, especially for each of us as individuals, it's only part of the picture. We really actually can't talk about individual health without talking about the larger context that we all live in. And so this, my most recent book, Unconventional Medicine, is really about taking back health care, whereas my first book was about taking back our health as individuals and addressing the society-wide and even, I would argue, global problems we have with addressing chronic disease and reversing that really dangerous and scary trend.
Yeah, I think you said in your book that 7 out of 10 deaths are due to chronic disease. And I think most people listening have had that experience where they having anxiety or depression or stomach ache. And they're either just offered a pharmaceutical very quickly or like, you know, an antidepressant. And wonder if you could speak to like why, you know, why isn't the system improving? Like if we all know, it's so frustrating to me when I listen to the news and they argue about healthcare, and it's like, it's never talking about actual like disease and treatment of healthcare, right? It's just like, let's move money here, let's move money there.
That's
So
right.
what's wrong? Like what factors are playing in that like nobody in charge, so to speak, is like waking up to this?
Mm-hmm. Yeah, I've drawn the analogy that our healthcare debate is analogous to like rearranging the deck furniture on the Titanic, you know, as it sinks beneath the ocean. I think there's a lot of ways to answer that question. First thing is we have to recognize that health insurance is not healthcare. Health insurance, which is what the whole healthcare debate has been about over the past several years, is a method of paying for healthcare. And that's a really different thing. And the crucial thing that has been left out of this discussion is that there is no method of paying for healthcare. I don't care whether you're talking about individuals paying out of their own pocket or governments paying or corporations that employ people paying. None of those methods are adequate in the face of the rising rates of chronic disease that we're seeing. We simply will not be able to pay for our healthcare in any way, shape, or form if we don't get a handle on chronic disease. And that is like the big elephant in the room with all of these healthcare debates and conversations that nobody's talking about. And it's incredibly frustrating to me as well as you. The reason that our system isn't adequate, I mean, I would actually argue that our system is working exactly how it was designed. And that's the problem. Because our system was designed during a time when the major challenges that we faced were acute problems. So if you look at 1900, the top 3 causes of death were all acute infectious diseases like typhoid, tuberculosis, and pneumonia. And other reasons that people saw the doctor were also acute problems like a broken bone or a gallbladder attack or an appendicitis. And the treatment for those problems was really straightforward. It was, you know, remove the gallbladder, remove the appendix, set the bone in a cast, and then once we had antibiotics, give the patient antibiotics for an infection. So it was just one problem, one doctor, one treatment. That's it. And that's really the milieu that our healthcare system evolved in. And so it was really kind of set up to deal with those problems. But fast forward to today, as you said, 7 of 10 deaths are caused by chronic, not acute disease. And the 1 in 2 Americans has a chronic disease. 1 in 4 have multiple chronic diseases, including 30% of kids. So the main reasons that people are going to the doctor these days are not because of a broken bone or an acute infection. It's because they have irritable bowel syndrome, or they have, Hashimoto's, or they've got, any number of chronic diseases, diabetes, complications related to obesity, et cetera. And those chronic diseases, unlike acute problems, are complex, they're difficult to treat, and they often require treatment for a lifetime. So it's a totally different set of needs. And our system has not evolved. I mean, it's still operating in that old paradigm. And so we need a new medical paradigm, a new model that is actually more consistent with what we need, which is, to address chronic disease.
Yeah, it makes a lot of sense. And I think it's an interesting intersection even between like what you're talking about. Your old book was individual care versus this, is because it's like there are these kind of premises that more and more people are waking up to, like eating a healthier diet, going to bed earlier. But often I find, and I'm sure you see it in your clinic, like by the time people have kind of woken up to these habits, they maybe already have a few chronic diseases, like you mentioned, they're autoimmune, and those are complicated to treat, especially yourself. So you do need a practitioner, and that's often where I start to see some of the first friction, so to speak, like when people are reaching out to us, or maybe through your blog, it's like they know they need more, but then it's pretty quickly goes to being, it's got to be out of pocket, right? Because it's not covered. If you want lab testing, if you want your gut checked. And what I found, I used to be in the insurance model before. I'm not. I just find that people have the mentality that their healthcare should be paid for by an outside party. I don't know if you run into that or not. So it becomes this like, I don't know, not everyone has a conflict there, but I think you gave an example in the book, like, maybe someone starts functional medicine process, they spend $5,000 on testing and treatment. And that's often just an expense no one has ever considered, so to speak, because we were sort of raised to think that this health insurance model would take care of us. So
Right.
yeah, I
Right.
wonder if you want to kind of speak to how you could see that evolving, or what you see with people who come to you.
Yeah. By the time people get to me, they're usually in pretty bad shape, and they've seen so many people. And I think our patients are a little more motivated than the typical patient in that regard, and their expectations are a little different for that reason. But it's almost irrelevant what my patients what their expectations are, because they're so different than the general population. And if we want if we want to really reinvent healthcare and transform this problem that we're facing, we have to create a solution that's going to work on a broader scale. Otherwise, functional medicine will always just remain a niche thing that's only available to people with the resources to pay for it out of pocket. And that's kind of one of the reasons I wrote this book, is because I'm not satisfied with that as an outcome. And
Yeah.
I don't think that's equitable. And I don't think it's sufficient to address the problems that we're facing. So, there are a lot of different ways that this could play out. But one is, I went back to saying health insurance is a method of paying for healthcare. It's not healthcare itself. And so one of the main things we need to do is pull those things apart in people's minds, because I think right now we all think of, not all of us, but the general population thinks of health insurance as healthcare. There a lot of things are possible where there could be a system where health insurance covers covers the things that conventional medicine really excels at. If you get hit by a car or bus, you go to the hospital, that's covered. You get hit by, or you have an acute problem, you have a gallbladder attack, it covers that. If you have the need for like some kind of procedure, like a colonoscopy or an endoscopy, it covers that. But it doesn't necessarily cover the things that people have to do on a day-to-day basis to stay healthy and prevent and reverse disease. I mean, that largely falls into both the individual and the social camp, more so than this, like, expecting conventional medicine to keep everybody healthy. I mean, that really falls to the individual, to perhaps the family and the community as well. And maybe there's a way of paying for that that's not health insurance that would be better. Meaning, maybe people would spend less on health insurance premiums, and they would, because the health insurance isn't covering the cost, the exorbitant cost of treating chronic diseases like diabetes, for 50 years. And that money then is freed up for them to spend it on a health coach, a personal trainer at the gym, or any number of things that would actually have a big impact on their health and reduce healthcare expenditures over time. I mean, so that's one thing that has been proposed, one potential workaround. But even if we continue to use our current system, there are lots of ways that it could be different and far more efficient. So in the book, I use this example. It costs $14,000 a year to treat a patient with type 2 diabetes. And we know now that 100 million people have prediabetes or diabetes in the US. And we know that it takes only 5 years for someone to progress from prediabetes to type 2 diabetes. And we also know that people are being diagnosed earlier and earlier, including like 8-year-old kids now that are being diagnosed with type 2 diabetes. So imagine someone who's diagnosed at age 20 and lives to age 80, which is totally possible given our pretty advanced medical technology, which keeps people alive for longer than they would otherwise live with a condition like that. So that's 60 years at $14,000 a year. That's about $850,000 to treat that one patient over the course of their lifetime. Just that condition actually and its complications. That doesn't take into account what happens if they get another disease or other disease, have other problems. So imagine if that patient went into the doctor early on in this process when they were 20, or even when they were 18 and they had prediabetes instead of full-fledged type 2 diabetes. And the doctor said, okay, well, you've got high normal blood sugar, and we know that in 5 years, if we don't address this, you're gonna end up with full-fledged type 2 diabetes. So we're gonna set you up with our health coach that we have on staff here and our nutritionist, and they're gonna give you recipes and meal plans. They're gonna hold your hand every step of the way. You're actually gonna go to your home and do a pantry clean out with you, and they're gonna meet you at the grocery store and show you what to buy there. And then we're also going to set you up with someone in our personal trainer network at your local gym, and they're going to show you how to, set up a physical activity routine that will help. And within 6 months, you're going to be back to normal blood sugar, which means you're not going to progress to type 2 diabetes. And, that could very realistically save the healthcare system almost $1 million for that one single patient over the course of her lifetime. And even if you had to spend $5,000 on that health coach and personal trainer, in that 6-month period, which I think is generous, you could probably do it for less than that. That's a huge return on investment, right? $5,000 to save like almost $1 million.
That's true.
There's no reason other than our will and our, the way we are approaching it, that can't happen. There's no fundamental obstacle that's keeping that from happening.
Yeah. So when I ran a clinic and took insurance, I was an acupuncturist, and we had neck chiropractic, naturopathic, and definitely, like you said, like a lot of it was preventative medicine. But frankly, I think the only reason that we were really covered was as kind of like a trendy perk, for people in my city. So I feel like in some ways, it was awesome that people had insurance and could pay to see us, and it probably kept people out of like back surgery and, anxiety attacks at the ER and stuff like that. So in that respect, I think it was really fantastic, but there were still downsides. Like we weren't really integrated. There was a certain sense of not really being respected, so to speak. And then taking insurance is just a giant nightmare for the practitioner, as you kind of cover in your book. So I don't know how that can all flesh out. I mean, I can say for my account, we have an HSA. I really like that because it gives me a lot of individual choice. I spend it on all sorts of things I like to. But yeah, I mean, I can see that like part of that, I guess I'm trying to say, has already been integrated a little bit, but I think in a way that was not very intentional, I guess you could say. And I don't think it was patient-centered in a true way. I think it was, just a little perk. And then over the years, they'd kind of cut us down, like, oh, we're going to make your copay higher, or we're going to pay the practitioner less. And
I mean, there's no doubt that there are a lot of changes that need to happen. But what's also true is that they will happen one way or the other. The system that as it exists is not sustainable and is not going to survive. And I think there's pretty much universal agreement about that. Even within the conventional medicine world, there's a recognition that we're on an unsustainable path and that we can't continue with business as usual. They just don't have any idea about what to do about that. There's very little controversy, I find, about that fundamental point. I've rarely encountered someone who said, geez, our system's working great. There's little I would change about it. And, the future outlook is bright and rosy. Nobody says that. I mean, the argument is perhaps around what to do about it, but nobody believes that it's serving patients well and that it's financially sustainable. I mean, some of the estimates suggest that if the healthcare expenditures continue to grow at their current pace, that the U.S. government will our entire budget will be consumed by healthcare expenditures alone. We won't have anything left over for education, infrastructure, anything else that we do. And so, I mean, that's just, So I think we're going to get to the point where we have to have this conversation about a new system. I hope that we can get there without having a complete collapse of our current system, because it's going to be a lot more painful and difficult to recover from that than it will be if we make the changes proactively. But I think, to some extent, we're going to get there one way or the other.
Yeah. So I'm trying to think about how this can all happen, because you mentioned in the book, like, some of the influencers here are pharmaceutical industry, insurance industry. Even you mentioned, like, a lot of the studies that are run are funded by pharmaceutical industry. So there's people who have their own interests. I mean, I could see someone like you, or like you mentioned in your book, the Cleveland Clinic is like a big success. Like putting someone like Mark Hyman, like, in charge of a program. People go crazy for it. People want it. So I don't know. I wonder if there's a way to get, people who are thinking outside the box to go ahead. I think you know where I'm going.
Yeah. I mean, so there are a few things. First of all, the pharmaceutical industry influence is uniquely strong in the US. There's no other country in the world where the pharmaceutical industry has the power that it has here. And we have allowed that to happen. As voters and politicians in this country have allowed that to happen. So we actually do have some control over that. And whether we take that control and do something with it is another question. But and now that they're in that position of power, it's of course more difficult to get them out, because they spend $250 million a year, $250 million lobbying Congress, more than any other industry there is. 10 times more than the gun lobby. We hear a lot of discussion about how powerful the gun lobby is. Well, they spend 25 million a year, and big pharma spends 250 million. So yes, that's a deeply entrenched financial interest, and they're publicly held corporations who have a fiduciary interest to maximize the profit of their shareholders. So, for better or for worse, that's what they're designed to do. They're fulfilling their obligation in a capitalist system. And nevertheless, in other countries, there are laws that prevent, that basically regulate the pricing of drugs. And we could enact laws like that here. I'm not saying it would be easy. I'm not saying Big Pharma would just lay down and not work to prevent that from happening, but we could do it. So if there was the political will and the support to do it. In terms of moving the conversation forward, I think there are some really promising things happening, like you mentioned. The Cleveland Clinic Center for Functional Medicine, that's a private institution, but it's prestigious and well known around the world, and they've just blown up. I mean, they started with a small space, and now within months had moved into taken over the whole second floor of the Glickman Tower at Cleveland Clinic, which is what houses the number one, cardiology and urology departments, which are number one in the world. So they've already attained a pretty high status within the Cleveland Clinic, and they've got a huge wait list of patients, and it's getting attention for sure. And you can be sure that Mayo Clinic is looking at that. I actually just got a tweet this morning from a doctor who had read my book, who was going to speak with someone pretty high up at the Mayo Clinic today about my book and about, just the changes that are being proposed. And we know Mark Hyman, who's a friend and, the head of the Cleveland Clinic Center for Functional Medicine, has been going back and forth to Dubai, where Dubai wants to set itself up as a center for medical tourism. So if you have to go get some kind of procedure and you want the best of the best, and they're actually looking at using functional medicine as the default care model for for this whole medical paradigm that they're setting up there. And I heard last week, I got an email from a venture capitalist, an angel investor who wants to invest in functional medicine. I mean, this is like this. I can guarantee you, I was not getting emails like that, 5 years ago or even 3 years ago. So it's getting on the radar, and it is starting to shift, and people are paying attention. And it's only a matter of time before people at the state government level and federal government level start to hear about this. We're doing a program with the Berkeley Fire Department right now, where we're working with their
Yeah.
first responders and setting up a wellness program. And if we can show that we save money for the city of Berkeley over time because of how functional medicine works, that's going to get people's attention. So a
Yeah.
lot of little things happening in a lot of different areas, and I do tend to think this will be a bottom up change instead of a top down change, just because of the nature of this. And it's definitely not going to happen overnight, but there's some really promising signs.
Yeah, I suppose, that this medicine works and people get excited about it and they talk about it, and you and I are talking about it, but also I'm sure your clients go, I mean, some of the best cheerleaders are clients who've never experienced it, and then they're like, oh my gosh, this is incredible, and they want to tell everyone. So yeah, that's a really good point. That sounds that gives me some hope. I like that. So let's shift gears a bit and talk a bit about your clinic and how it's set up. You mentioned earlier you kind of just started on your own, seeing clients, and it's evolved. Your thought process has evolved too, and you're teaching practitioners how to take on a model like yours. So tell us about your model.
Well, we have 5 clinicians now, and health coach, nutritionists, and fairly large support staff that holds it all together. And we work intensively with patients on diet, lifestyle, and behavior change as the foundation of everything else. So we recognize that if you don't have those pieces dialed in, there's not really much point in doing a lot of fancy functional medicine lab testing and treatment protocols, because those things are the foundation. If that's not in place, nothing you build on top of that is going to be very successful or long lasting in terms of its impact. So I think that was even though all of us as clinicians believe that and recognize that, I think in the last 2 years we've really started to shift the way that we're set up to support that and reflect it. And we're still working on it. I would say in the future, I could see us getting to a point where when somebody comes to see us as a patient, they work intensively with the health coach for 6 months before they even see a doctor or a practitioner. In my case, most of my patients have already done that before they come to see me, so it's a little less necessary. But still, even in those cases, there's a lot of leeway or a lot of progress that could be made just through further tweaking of and addressing areas that have been left out. All of us have blind spots or areas that we know we need to work on, but we're less likely to work on. So, for one person, that might be stress management. They might be spending all their time looking at every little diet tweak they can do, and they're on a low histamine, autoimmune, low FODMAP. They've got their diet totally wired, and they're trying to eke out the last 1% benefit that they can get from their diet, and spending hours a day doing that, when actually they get a lot more progress from spending some or most of that time taking care of themselves in other ways, developing a meditation practice, or spending time outdoors, going for a walk in the woods, or getting a little bit more sleep or whatever. So that's where a health coach can really come in, play a big role in supporting people in first identifying those areas, where they're not putting as much energy and attention as they need to, and then providing them with the support that they need to do that. So that's a pretty big shift, I think, for us. And then we're also, over the next couple of years, going to be focusing more on groups and classes. So people who have a similar health condition or have similar goals, providing opportunity for them to come together both in person or on a Zoom video call like this, if they're distributed around, because we have patients who come to see us from all over the country, which can leverage, there are certain types of information that don't need to be delivered one-on-one, and they're going to be consistent across a group of people who share a similar condition. And so when you when you do it that way, you can really leverage the people that you have working at the clinic to make a bigger impact. And then from a patient perspective, you can build community and prevent some of the isolation and alienation that chronically ill people often feel. They get to see meet other people who are struggling with similar conditions, and they don't feel as alone as they do. So there are a lot of ways that we can change this model of like what a health clinic is and provide a much higher touch level of care to patients, actually build community around that, and serve people in a way that's really going to create lasting change and actually help them to reverse their problem instead of just creating patients for life.
Yeah.
I think the conventional model does.
Yeah, I think like I'm working mostly online now, and I think it's evolving for me, and I think for other people too. Like when I was a newbie, so to speak, I was like, oh, I was supposed to have these group programs, and I did, but I was so new that I couldn't get very many people in that. It was leverage, but it wasn't that beneficial for me. So then I studied functional medicine, and I was like, oh, I want to do all these labs, and we did a one-on-one. But kind of like you said, some people weren't really ready. There really isn't a point in running $1,000 of tests if you're eating processed food and such. So some people, the majority of our people weren't in that camp, but some were. So now we're going to offer like a foundations program and probably have everyone go through that. It would be really affordable before they graduate to private coaching. Because as much as I love, running labs and all this, it is expensive and it's out of pocket. And sometimes I go back and forth on like, when is the lab really needed yet or not, which I'm sure is something you have to decide every day as well.
Yeah, and I think there's an interesting thing that happens when you have the ability to order labs, and that's within your scope of practice and practice that model. I think it can be, I've seen this happen for myself and also in other practitioners, that can become a kind of a crutch or even a distraction might be a better word. And if you don't have that within your scope of practice, you're forced to do as much as you possibly can with diet, lifestyle, and behavior change. And it's kind of amazing to see what you can accomplish that way. So myself as a clinician that can order labs and prescribe treatment and all of that, I kind of try to operate from the almost to pretend like I can't do that and see how far I can get with, like if I couldn't do that, what would I do in this situation? And then if the answer is XYZ, let's try XYZ, and if the answer is nothing, I would refer them out to someone who could order labs. Then that's probably the time to order the lab. So it's just, a shift in my perspective and how I work with people that's happened over time.
Yeah, I like that. I like that a lot. So one question I'll get from time to time with people in my community, they'll reach out and say, well, like I'm a coach just getting started, what do you suggest? Or I don't know, they just come to me for ideas. And what I always say to them is, why don't you find another practice that you can work within? Yeah. And that's something you encourage in the book, which I thought was great. And not everyone has to do that. I mean, some people might want to be independent, but like you said in the book, like people don't always have like the business chops to go and do all the marketing and all the work.
It's hard.
Yeah. And like you said, there are people who are clinicians who their clients need someone to give them a meal plan and get,
that's right.
That's the time. And so some of them write back and say, well, how do I find that? Or, oh, I tried one person and he said no. It's like, well, you gotta keep trying. So
persistence pays off.
Exactly. What would you suggest for them to look and how to approach it?
Yeah, well, there's no place to go right now for that. And I launched a membership platform called the Adapt Academy earlier this year, and not just a few months ago, actually. And one of the main purposes of that was to create a central place where clinicians and what I call allied providers, people like health coaches, nutritionists, can come together and who share a similar perspective. So, who are looking at things through a functional medicine lens, through ancestral diet and lifestyle. And then they can network. They can, there's a forum where a doctor can say, hey, I'm looking for a health coach, or a health coach can say, hey, I'm looking for a doctor. And because up until now, we haven't really had any kind of central place for that. And it's just starting. We have about 1,200 members now. And I think over time that will climb considerably. And the idea is that we'll have pretty regular networking events. We're going to have our first in-person annual conference in 2019. So that will be a great opportunity for people who are in this, like you said, who are looking for doctors. And we'll actually have networking sessions set up at that conference that are explicitly designed to bring people who are looking for, clinics to work with and clinics who are looking for coaches to work with together. So I think that's going to change a lot in the next couple of years, and there's going to be a much bigger, better infrastructure for that. And I'm working hard to create that. I would also say that anybody who's actually, I believe that a collaborative practice model is the best option, regardless of whether you are working as an employee in a clinic or even if you're independent. Because if you're an independent coach, you will inevitably have clients that need more support than you're able to offer. I mean, that's as sure as the sun is going to rise tomorrow, that's going to be the case. Even if you're the best health coach in the world, some people are going to need that breath test because they have SIBO, and they're going to need, rifaximin or an herbal botanical protocol or something that's outside of your scope of practice that needs to be addressed. Or, they'll have Hashimoto's, or, any number of things that go beyond what a health coach can do. But the same is also true for clinicians. As sure as the sun will rise tomorrow, a clinician's going to have a patient who is just not eating well and not sleeping. They need, they're sedentary and they need to adopt a physical activity routine, or they're not managing their stress. And even in a functional medicine model, if you have a half hour or a 45-minute appointment with them on a follow-up, and you're reviewing 3 labs and you're prescribing treatment, you're not going to have enough time to give that patient the support, especially if you only see patients once every 2 or 3 months, like most practitioners do. So you as a clinician will need a health coach if you want to provide the highest level of care. And so, I think how that relationship is set up is kind of is really just dependent on personality. Like, are you the kind of person who likes to have your own business and, have the independence that comes with that, and also the challenges that come with that? Are you the kind of person who would rather just be an employee and work in a collaborative environment? That's secondary. The primary thing is the collaboration that's happening, so that you have a referral, whether it's the referral is happening within the clinic or whether the referral is happening from 2 independent, entities that are sending people back and forth. It's that relationship, that collaborative relationship that will make the biggest difference for your clients and also for your success as a practitioner.
Yeah, I don't know if you know this, but the name of my business is Women's Wellness Collaborative, and
I saw that on the calendar.
Yeah. And our kind of flagship program, we have 2 people working on one case, and it's not exactly it is like a coach clinician. Neither is a doctor, but because I just think too, it's so valuable to have 2 perspectives on your case,
Totally.
Even if you've not I can't figure this case out, just a different perspective is a different perspective, and it's valuable.
So we have something similar. It's, right now a nurse practitioner does the initial consult with the patient. And then when they come to the clinic, I meet them with the nurse practitioner by my side.
Oh, okay.
In the appointment. And then after that initial consult with me, they do check-ins every couple of weeks with the nurse practitioner and or the health coach, depending on what their needs are. And then maybe after 2 or 3 months, they have a follow-up with me. And we're going to be changing that soon so that the health coach will do the initial consult. The nurse practitioner will be with me in that initial appointment, and then they'll interface with the health coach and the nurse practitioner mostly, during the follow-ups, except they'll see the clinician maybe once every 3 to 6 months. So they get a very high level of care, frequent touch points, but it's not all just with the clinician. And in fact, I think the appropriate ratio there would be something like 3-to-1. For every one interaction with the clinician, they have 3 interactions with the health coach, the nutritionist, the nurse practitioner, because those are the practitioners that are really doing the day-to-day implementation and providing that level of support. And the good news with that kind of model, I mean, there's so many advantages. First, like you said, they have lots of different perspectives. They just feel a lot more supported because they have multiple people that they can draw on. They're going to receive a lot higher level of care because they're not only going to get lab testing and functional medicine support, but they're also going to have a nurse practitioner who can kind of explain things, that answer their questions that might not have been answered in the appointment. They're going to be able to help them with their labs and help keep them on track with their protocol. They're going to have a health coach that helps with their diet and lifestyle and behavior change. So it's a huge win for the patient, but for the practitioners, it's a big win too, because, for me as a clinician, I'm not doing everything.
It's too much.
It's too much. I mean, I have, then my nurse practitioner can answer most of the questions totally adequately. She doesn't need my input on 90% of the questions. And if she does, she can come to me. So that dramatically cuts down my, administrative work in between appointments. The health coach is able to provide the diet, lifestyle, and behavior change guidance that I would otherwise have to provide. So, and then, we are the practitioners at our clinic are communicating regularly. So if I have a patient, who's got a complex chronic infection, I will consult with Dr. Schwag, my co-director, or Ramsey, Dr. Asfour, who's an infectious disease specialist.
Wow.
Their take on, Dr. Asfour used to work for the WHO and, he traveled the world, and it's awesome to have his take. And if I have a patient who has a question about a radiologic procedure that they had, I'll ask Dr. Net, who works with me, because she was a radiologist at Stanford before she came to work at the clinic. I mean, that kind of collaboration is just awesome because the patient feels like they're getting, 5 doctors and practitioners for the price of one. And as practitioners, we have that just, years, decades of experience but beyond our own to draw from. So it's really the way that medicine should be practiced, I think.
Yeah, and I appreciate that you saw some of the shortcomings and you addressed them. If people have been listening to my show, I've been sort of ranting on functional medicine lately because I see too much of, the half an hour, very expensive appointment, lots of labs, lots of supplements, and there's really no coaching. If you don't implement that stuff, it's a huge waste of money. And I don't want functional medicine, functional nutrition to get the reputation as being a waste of money, certainly. So I'm glad to see you integrating. It's really great. Well, let's talk about some of your resources. You have the Adapt platform or website. Let me see if I have that URL. We'll get it. And then you've got the Kresser Institute, where you're training practitioners more in a clinical way, right?
Yeah, one of their goals for 2018 is to address some of the confusion. That's because we just had so many things happen in the past couple of years. It's been hard to keep it all clear in people's minds. But Adapt is the name we use for our overall approach, and that encompasses everything that we do. And that approach has 3 elements to it. One is functional medicine. 2 is the ancestral diet and lifestyle, so like a nutrient-dense paleo type of diet, and then but not just that, just looking at lifestyle and behavior through the lens of like what is normal for human beings to do. And then the 3rd element is, not surprisingly, the collaborative practice model that we've been talking about. So we have training program now for doctors and other licensed practitioners to train them in that Adapt approach.
Okay.
And that's been going for a couple of years, and I've trained almost over 400 practitioners now, or have either graduated or in some stage of the training process, which is really great, all over the world. next year, I'm really excited about launching the Adapt Health Coach training program.
Oh,
So
okay.
we're going to be training health coaches in the same Adapt framework methodology that I just described with those 3 elements. And that's going to be launching it will start in June, but we're going to open enrollment in April. And then we have the Academy, which I mentioned earlier, which is a month-to-month learning platform that's really more for, the practitioner program and the health coach program are 12-month intensive, long, juicy, big programs. And not everyone's ready, to do that. It's a big commitment of time and money. And we wanted to have a way of people kind of dipping their toe in the waters of this adapt approach without making such a big financial and time commitment. And also a way to earn CME and CEUs in your profession that you're actually interested in. As an acupuncturist yourself, I am as well. If I want to earn CAEUs, I have to go and do acupuncture or herb courses, which, I like herbs and I still use them. I'm not doing acupuncture, but that's not the best way for me as a functional medicine provider to earn CEUs at this point. I'd much prefer to do functional medicine courses and earn my CEUs that way. And so that's what the Academy will offer as well, starting in February. And more than anything else, like I said, it's meant to be a community of people who share interest in this approach and want to come together and support each other in their development. So
Okay.
That's
To
the
be,
landscape.
gotcha. So to be a little clear, when you mentioned earlier as being an online place, people could say, I'm looking for this or that. That's within the Adapt Academy.
That's right.
Okay. Yeah. And I'll mention my colleague, Sandy Scheinbaum has functional coaches Institute or something. I'll put the link, but they, because once I told her I'm looking for a coach and she said, well, you can post it to our coaches, or I'm an FDN and, they have a community too. So there are different communities, probably starting with where you studied, right? But yeah, there are other things too out there, which is, it's great.
Yeah. I mean, we're going to see a lot of change in that world. And there's a lot of good stuff already happening, and there's going to be more and more good stuff happening in the future. And, there's just going to be, there'll be slight differences in terms of people's perspective. And that's great. That's exactly what we want. We want healthy. Yeah. It's healthy and it's appropriate.
Right on. Well, we're happy to support you as you launch some of these other endeavors, and we want to stay posted to your firefighters program and everything's going on.
That'll be exciting.
Yeah. Thanks so much for coming on the show, Chris.
Oh, it's my pleasure, Bridget. Nice to meet you.